Hello, anybody out there on YouTube who's watching my videos. Today is February 2nd, 2022, and let's see. I am a month and 2 days post-op from my TFCC repair in the right wrist, and I figured I'd shoot a brief update to let y'all know how things have been going. Haven't been a ton of new developments. Again, I don't have another post-op until the 24th, so I'll probably have a more detailed video about how that goes then. The 25th I start physical therapy, so there's going to be more things to talk about, but there's a couple of developments, I suppose. Well, first of all, about 2.5 weeks in, 2.5 to 3 weeks in, really felt like I was cruising along in my recovery. And I may well be, because the pain in my right wrist has really been almost not noticeable. If anything, it's been a little bit achy, you know, nothing crazy. But one thing of note that has happened is that I started overusing my left hand. And I really underestimated how much stuff I did only with my right hand before my surgery. Once my right wrist wasn't hurting so much that I didn't want to do anything, I started wanting to just do more stuff. I started doing household what have yous, washing dishes, doing laundry, whatever, moving stuff. And what do you know? My left wrist started really hurting because I was overusing it in ways that had never been used before. So it's almost ironic that this wrist right now hurts more than this wrist. So over the last couple of days, I've sort of decided to take it easy and not do anything all over again to sort of get this wrist back on the right track, and it has been feeling better. I'd say today is Wednesday. It feels definitely better than it felt Monday. Monday it definitely felt better than it did Saturday. So in 2-day increments, I think it's slowly getting better as I continue to really consciously go easy on my left hand. It's hard though, you know. On a medication standpoint, I, about 3 weeks in, exactly 3 weeks in actually, I got past the half-life of Eliquis, the blood thinner, so it was safe for me to start taking ibuprofen. So I'm on ibuprofen occasionally, and ironically, mostly for this wrist. This wrist has not been bothering me, which is pretty good. There's been a little bit of achiness towards the end of the day, to be expected. Considering how much medication I was taking before, though, I'm wherever I can get by without taking pain meds, I'm gonna do it, because, you know, I went through a lot of Tylenol. Almost scary. The PA that I saw said that it was safe. Looking back, it was still a lot of Tylenol. I exhausted this entire bottle of extra strength Tylenol. This was brand new and sealed when I had my surgery. 100 tablets, 500 milligrams. I was taking 1,000 milligrams 3 times a day, like clockwork, every 8 hours. And frankly, it was necessary because my wrist was hurting like hell. But just thinking about how much that was for 3 consecutive weeks, that's a lot of Tylenol. I even, not just this, but I even went through a little bit of a little bottle that I had just in the cupboard. I happened to have it, and I used the rest of that too, which was equated to about 2.5 days worth. So decided no more Tylenol at all. I'm only doing the ibuprofen when I need it. Luckily, I'm past the half-life of Eliquis, so I don't have to worry about bleeding too much. This should be healed enough where it wouldn't impair the healing, and I did double check with the PA. I emailed her to make sure that was fine. She gave me the go-ahead to use about 600 milligrams worth of ibuprofen per day as a limit, but to take less if I can tolerate it. Right now I'm taking not even 400 a day. I'm just I might take one pill once a day if my left wrist is really bothering me, and that is ironically has nothing to do with this. So that's where I am medically. Really looking forward to getting out of this brace. I've had to super glue it back together a bunch of times. I can't believe that, like, the Velcro pads that they gave me, the adhesive is just so weak. And if I didn't have crazy glue, super glue rather, to use, I don't know what I would have done. And in a couple of spots, as I mentioned in the last video, it got through the holes and irritated my skin, which sucks underneath this brace. I've been taking my arm out of the brace once a week on Saturdays to change out this tube sock material that they sent me home with. I have a couple more of them. I'm not really washing them. They're so thin they just fall apart. So when I take them out, I just throw them away. They smell awful anyways. So I'm replacing that tube sock material once a week, and when I do that, I take a wet washcloth, some hot water, and I just give my arm a good wipe down. Keep my wrist specifically in a neutral position, straight. I notice that if it even comes close to bending, doing any of this, very painful. So that could be a combination of the surgery or just being stiff from not moving. You know, it's going to be a process getting all my motion back without pain, but I definitely don't want to push it. So, you know, originally I was going to go see the PA on the 14th and wean myself off the brace starting then. There was a snafu with the scheduling, and so that put me on the 24th instead of the 14th. I talked to my surgeon. He said, you know what, that's probably just fine. We got to make sure that the wrist heals as well as possible, so just do the 24th. That pushes my final recovery window forward by a couple of weeks. So instead of, you know, the 4th of July, I'm looking at probably July 15th or so, or something like that, for you know, an ETA on unrestricted use of my wrist. So we still got a good chunk of time left. It's a process, and I only hope that I don't need to get this surgery again. As I mentioned before, there's about a 30% chance I'm going to have to get my ulna shortened in the next few years, and that is a much longer recovery window. So hopefully this is a one and done. I'll have more updates as new developments happen, but that's sort of where I'm at now, 1 month post-op. I've got my ibuprofen, vitamin I, and I'm soldiering on. Thanks for watching.